Most people associate chest pain with heart attack, but many episodes of chest discomfort are something called angina. Angina is not a heart attack. It is a warning. It is the heart signaling that blood flow is insufficient, but not yet completely blocked. To understand angina, we must revisit oxygen supply and demand. Angina is chest pain or discomfort caused by reduced blood flow to the heart muscle. The heart requires a constant supply of oxygen-rich blood delivered through the coronary arteries. When these arteries become narrowed by plaque, blood flow is restricted. At rest, supply may still be adequate, but during exertion or stress, the heart demands more oxygen. If supply cannot increase to match demand, pain occurs. This imbalance is called ischemia. Heart muscle cells rely heavily on aerobic metabolism. When oxygen levels fall, energy production decreases. Lactic acid and metabolic byproducts accumulate. Local chemical changes stimulate nerve endings. Pain signals travel from the heart through nerve pathways to the brain. The brain interprets this as pressure, tightness, or squeezing in the chest. Sometimes pain radiates to the jaw, shoulder, or left arm. When activity stops, oxygen demand decreases. Balance is restored, and symptoms improve. This is classic stable angina. Stable angina is predictable. It occurs with physical exertion or emotional stress. It improves with rest or medication such as nitroglycerin. The underlying plaque usually has a thick fibrous cap. Blood flow is reduced, but stable. The artery is narrowed, not suddenly blocked. While uncomfortable, stable angina is often manageable with treatment and lifestyle changes. Unstable angina is different and more dangerous. Pain may occur at rest. It may be more intense or longer lasting. It is unpredictable. This usually indicates a vulnerable plaque. These plaques have thin fibrous caps and are prone to rupture. If rupture occurs, a clot can form suddenly. If the clot completely blocks the artery, a heart attack occurs. Unstable angina is considered a medical emergency. Not everyone experiences classic chest pain. Some people, especially those with diabetes, may have nerve damage that reduces pain sensation. Older adults and women may experience atypical symptoms such as shortness of breath, fatigue, nausea, jaw or back discomfort. This is called silent ischemia. The heart is suffering from reduced oxygen, but the warning is subtle. This increases risk because medical care may be delayed. Diagnosis begins with medical history and symptom pattern. An ECG may detect electrical changes during ischemia. Stress testing evaluates the heart under increased demand. Imaging tests such as CT coronary scans or angiography visualize narrowed arteries. These tests help determine severity and guide treatment. Early detection can prevent heart attack. Angina is not just chest pain. It is the heart asking for help. It tells us that coronary arteries are narrowed. It warns that plaque has progressed. It provides an opportunity to control blood pressure, to improve cholesterol, to stop smoking, to manage diabetes, to prevent rupture. Understanding angina means intervening before a heart attack occurs, and prevention is always more powerful than emergency treatment.